What's going on, everybody? It's Alex here from Aleks Physio. So today we're going to be chatting a little bit about disc herniations, what they are, what causes them, different kinds of disc herniations, and what you can do about them. But before we do that, I need you to hit the like button, the subscribe, and hit the bell notification for more videos. It really helps my channel grow and it helps me reach more individuals. I'm going to be using this skeleton model just to kind of explain what a disc herniation is and what happens with it. But before we do that, let's just talk about some general anatomy. We have 5 bones in our low back: L1, L2, L3, L4, and L5. And within each bone of our back, or in between each bone of our back, is a disc. And this disc is primarily responsible for shock absorption, but also for nutrition to the rest of our spine. And in that as well, or in between the vertebrae, the bone of our back, and the back, this here is called the spinous process, we have our spinal cord that basically runs through this foramen or this tunnel all the way down to about L1 or L2. And then it branches off into other nerve roots. And what branches off of this spinal cord are nerve roots. So as you can see here, we have little nerve roots that come off the spinal cord. And these nerve roots are responsible for a couple things. They're responsible for telling the muscles in our lower body or our upper body, depending on what level they're situated at. It tells the muscles to turn on, but it also receives a sensory input so that if you touch a certain part of your leg, that nerve root that's responsible for that section is going to tell your brain you're touching, let's say, the front of your thigh, so you'll know that. So when we have a disc herniation, the herniated disc decreases the space where that nerve can run, and then what happens is that nerve can get irritated. It can be because of a disc herniation, it can be because of inflammation, it can be because of a bunch of other factors, but one of them with the disc herniation is if it decreases the space and it irritates that nerve, what can happen is you can get some of those symptoms that run down the back of your leg, like those sciatic symptoms that you hear runs down the back of your leg or the side of your leg and goes down all the way into your feet. It's because depending on what level of disc is herniated, so the most common one is the L5-S1 level, there's a disc herniation that's going to correlate with depending on what body part is affected or where you feel the pain based on what level the disc herniation happens at. So here we have, this is at L3 and L4, that's where the disc herniation. So you're going to have different symptoms versus if the disc herniation was L4, L5, or even lower at L4, L5-S1. So it's important to note that anything that decreases the space here can give rise to pain going down your legs. It can lead to numbness and tingling, and it can lead to weakness in the muscles that are responsible for being activated depending on what level is affected. But again, it's also important to know that there's a lot of individuals who have disc herniations and don't have any symptoms at all. You can do an MRI of my back or somebody else's back with no symptoms, and it says a disc herniation. So it's important to know that disc herniations are common in individuals who have pain and neurological symptoms, but also in individuals who don't have pain. Another thing that's important to note is that there are different types of disc herniations. There's 4 different types. From the least severe, we have the disc bulge, which if you think about a disc being like a balloon, if you apply pressure in the middle of the balloon, it's going to bulge outwards. Then you have a disc protrusion, then you have a disc extrusion, and you have a disc sequestration, which is basically the inside components called the nucleus pulposus, which is like the jelly-like substance. It herniates outwards and it comes in contact with the nerve root. So you may think that with the 4 types of disc herniation, the worst one is going to have the worst likelihood of getting better, right? Wrong. That's actually not the case. And there is some research that supports that actually the worse the disc herniation, the better the prognosis that it'll spontaneously resorb or return back to the original position. So remember, a disc is composed of two parts. You have the nucleus pulposus, which is the inner part, the more jelly-like substance, and then you have the annulus fibrosus, which encircles that jelly-like substance that's formed of more cartilaginous rings that just gives it a little bit more structure. And this helps to kind of hold the contents of the disc when there is an injury. One of the most common types of injury or ways to get disc herniation is a trauma. What do we do about disc herniations? How does it get better? Most of it gets better with time, but another way that it can get better is actually with physiotherapy. So there's different things that you can do to manage these disc herniations conservatively. You can do various types of exercises. There's something called neurodynamic techniques, which are aimed to target rehab of the nerve and the nerve roots to help to get more blood flow to the area, and movement, just in general movement, to try to get everything moving a little bit more and get it less sensitized. However, the other thing that's important to know is that, and I work with a lot of spinal surgeons, is they look at what bothers you more. Is it the leg pain or is it the back pain? And we usually ask this in a ratio question. So if somebody comes in with a disc herniation that we found on MRI, and they say that they only have leg symptoms, they have some back symptoms, but the leg symptoms bother them, then surgery is more likely to be beneficial for this individual if they failed conservative treatment, physio, other sorts of rehab or therapeutic interventions. And a lot of the surgeons will say that they won't help. The surgery doesn't necessarily help with the back pain in somebody who has a disc herniation, but it helps a lot more with the leg pain and the pain more versus if people have numbness or tingling. It's more so targeted for pain. So some individuals come in thinking that they're going to have surgery, and when they have surgery, their back pain is going to be gone, but that's not the case. So it's important to be mindful of that there's a lot of different factors that play a role because pain is so complex. And MRI is an important part to diagnose these disc herniations, but it's also important to know that it's only one piece of the puzzle, and somebody's presentation is a lot more complex just because we are, of course, human beings. Lots of information, but I think it's important to know and review kind of what we chatted about. So we chatted about just the general anatomy, the different types of disc herniations, what actually happens with a disc herniation and how it looks like on a skeletal model. We also talked about what can be done if you have a disc herniation, as well as what some of the research says with individuals with and without disc herniations and the prognosis. We also talked about how this looks from a surgical perspective and what are the characteristics of somebody who would be a good candidate for surgery if you have sciatic-like nerve pain and issues more so in your leg versus your back. And that's pretty much it. So hopefully you found this information valuable. Hopefully you learned a couple things about what we just went over. If you felt that this information was valuable, or if you have any questions about anything, please leave a comment below. Again, it really helps support my channel, it helps grow my channel, and helps me reach more individuals. And then until next time, we'll see you for the next video. Thank you.